Thank you, Minerva. Lucy Barylak has a master's degree in social work from McGill University. She's presently working as a consultant for a health network in Montreal, Canada. She's also working at the School of Social Work. She has been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy's also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. In addition, on a personal note, Lucy would like you to know that she was a caregiver for her mother for 10 years. And with that, Lucy, take it away.
Thank you, Evelyn. Good morning and welcome. You know, as Evelyn said, I will be speaking today about what are hallucinations, paranoia, and delusions. Many people are not aware or understand the difference between these episodes. These behaviors can cause a lot of stress on caregivers. It's very important not to label people. Therefore, it's important to recognize the signs of someone having a delusion, paranoia, or hallucination, knowing the reasons why this is happening, and tips on how caregivers can manage the behavior and respond appropriately. So, but I want you to keep in mind, please keep in mind that if you are concerned about any unusual behavior that your loved one is displaying, call the person's doctor right away. Now, it doesn't necessarily have to be with the topic that I am speaking about today. It could be that they could become verbally or physically aggressive, or even sexually aggressive, or they're really up, and not even that, they could also be just lethargic and just not themselves. So keep that in mind. So it is important to understand what these terms are all about. And even when you call the doctor, it's important to know that you've noticed that your loved one is actually being delusional. But I do receive a lot of emails from caregivers asking me about different topics. I want to share a few with you today because they are part of my discussion. So here we go. Dear Lucy, in the last few weeks, my mother, who lives with me and my husband, has started behaving very strangely. Mom has dementia, but recently she has started talking to someone who's not there. It appears that she's actually having a conversation with this invisible person. She looks very happy, smiling, and having a good time. I asked her who she's talking to, and she said the neighbor down the street. I was shocked because Mom is forgetful, but never did that before. I told her that no one was in the house, and she got very upset with me and told me that I don't know anything. Did I say the wrong thing? What should I do? And she signed it, Rebecca. Here's another one. My husband has been diagnosed with dementia 4 years ago. I'm his main caregiver and truly love this man very much. It's becoming very difficult for me in the past few months. Michael has started to accuse me of taking money from his wallet. He has not carried any money in his wallet for many years. I tried to explain that to him, but that I never took any money, and he asked him to stop accusing me. He turns his head away and stops talking to me. This has been going on almost daily, and I'm very frustrated and don't know what to do. It's becoming very difficult, and I feel lost and not knowing where this is coming from. Yesterday, he accused me of having an affair with the neighbor next door. Thank you for listening. And she signed it, Mabel. And here's the last one. My parents are both in their 80s, and Dad is caring for Mom, who has Alzheimer's for the past few years. On my last visit, Mom was very agitated and was not herself. She was pacing up and down around the living room and refused to sit down on the couch. I asked her what was the problem, and she said that the cat was sitting on the couch. My parents do not have a cat, and there certainly was no cat sitting on the couch. I tried to tell her that there was no cat, but that made her even more agitated and upset. It took a long time for her to finally go and lie down in her bed. My question is, what is happening to her, and what should we be doing? Sincerely, Isabel. Well, first of all, I want to thank Mabel, Isabel, and Rebecca for your questions. And I will try to answer your concerns in my general session this morning. It is very frightening to experience such behavior from your loved one. It can be confusing, overwhelming, and having no control on how to handle the situation. But I want to tell you, you are not alone. There are many caregivers who are going through the same difficulties. And I hope that this session, will give you some clear understanding of what are these issues and some tips on how to handle this kind of a situation. So next slide, please.
Lucy has a minion today, folks.
Lucy, what?
You have a minion today.
Oh,
Slide minion.
All right. So I really thought that it's important to just go over about what is dementia. I know a lot of you know about it, but it's kind of will reinforce to you that people with dementia certainly can have delusions, hallucinations. So let's look at that. And this is from the World Health Organization. It was a document that was presented in September 2019. So dementia is a syndrome in which there is deterioration in memory, thinking, behavior, and the ability to perform everyday activities. Although dementia mainly affects older people, it is not a normal part of aging. So that made me feel very good, I have to say. Worldwide, around 50 million people have dementia, and there are nearly 10 million new cases every year. And I'm sure there is more because this report was from 2019. Alzheimer's disease is the most common form of dementia, and it contributes to 60 to 70% of cases. Dementia is one of the major causes of disabilities and dependency among older people worldwide. Dementia has a physical, psychological, social, and economic impact, not only on people with dementia, but also on their caregivers, families, and society at large. So let me just reinstate that dementia is a syndrome, usually of a chronic or progressive nature. For example, they lose the ability to process thought beyond what might be expected from normal aging. It affects your memory, thinking, orientation, comprehension, calculation, learning capacities, language, and judgment. So that's really a lot. Dementia results from a variety of disease and injuries that, primarily or secondary affect the brain, such as Alzheimer's disease, a stroke, any other form of dementia, and for some people with Parkinson's as well. So we know that if someone is suffering from dementia, their brain has been damaged. And so our expectations of their behavior should not surprise us, especially knowing that dementia is chronic and progressive. Things can change daily, and we need to be prepared for those changes and how to respond. So I have to tell you, on a personal level, things could have gone really well with my mom, and then all of a sudden one day it changes. So it's important to keep that in mind. Next question, please. I should say next slide, please. Okay, so that's what we're talking about today. What are hallucinations, delusions, and paranoias? We know that people with dementia may experience hallucination, delusion, and paranoia. So understanding the differences between these can be extremely, extremely helpful. Next slide, please. So let's start with hallucination. Make it very clear. Actually, it's a false sensory perception of objects or events. Individuals with Alzheimer's and dementia might actually see, hear, smell, taste, or feel something is not there in reality. Examples could include insects crawling on them or hearing people talking and thus responding to these voices. For example, Mabel's mother, she saw a cat on the couch, and to her it was extremely real. And Rebecca's mother was talking to someone who wasn't there. So if this is the case, if this is something that's going on, and if you call the doctor, you can actually say, I think that my mother or whoever you're taking care of is having some form of hallucination. Can we please, next slide? Okay, so delusion is a false idea or belief. This can sometimes come from misinterpreting a situation. Examples can include a person with dementia thinking a family member is stealing from them or that the police is following them. Just like Mabel's husband, he was accusing her of stealing and of possibly having an affair with the neighbor next door. So paranoia and delusion sometimes go together. So many times that's how we use it. It's kind of suspicious delusions, such as the ones that I was explaining above. However, it's important to remember that hallucination and delusion may or may not be upsetting to the person living with a dementia. Not all hallucinations are frightening, and not all delusions are paranoid in nature. Sometimes they may be a result of a person trying to make sense of things. For example, the person may not remember putting her purse away and concludes that it must have been stolen. So let's go over it again, okay? Paranoia and delusion is when a person cannot tell the difference from what is real or what is imagined. Hallucination is very sensory. They actually see, hear, smell, taste, things that are just in their own perception. So what I do want to tell you, as I said before, if anything like that goes on, it's really important to first and foremost, before the tips that I even give you, is to call the doctor. But the best way to start, as I said, is by arranging a consultation with the person's doctor. The physician can look for physical causes such as kidney or bladder infection, dehydration, pain, or alcohol drug abuse, all of which can cause hallucination or delusion. It's also possible that the treatments being prescribed for pain are the cause. If the physician prescribes a medication, watch for and report any side effects you notice, including oversedation, increased confusion, tremors, not sleeping, oversleeping. Even over-the-counter medication can cause hallucination or delusions. So remember that. Now, I want to tell you what most of the research tells us, that non-medical interventions are the best. Okay, that's really first and foremost, make sure that it's not a medical thing. And if it isn't a medical thing, it's best to try these tips out before actually having the person medicated for that condition. So interventions that are not medical in nature are the best ways to help someone experiencing hallucination or delusion, and I will talk more about it. But at this point, I'm just wondering if someone has any questions, or or it's unclear what I've been saying. So let's open up the lines.
Okay, folks, we've got an expert on a very confusing topic. Please just open up your phone line by pressing *6, or you can unmute yourself if you are on Zoom, or you can put something in the chat room. We would love to hear from you. Oh, you did a good job, Lucy. Nobody has a question.
Okay, that's great. I'm thrilled. All right. So if you think that your loved one is experiencing hallucination, a delusion, or paranoid, especially if you have not seen the doctor first, and the person are displaying some sort of these kind of behaviors, what do caregivers need to do? So next slide, please. And I'm going to go through each one of them, but I just want to kind of give you an overview. It's really important to assess the situation. Offer reassurance, use distraction, respond honestly at times, and I'll tell you when. Modify the environment, and obviously a last resort is maybe the person does need to have some sort of medication to calm them down. So what do I mean at assessing the situation? Look at how the person is responding to the hallucination or delusion. If it doesn't cause problems for the person, it's typically best to ignore them, okay? To just ignore it. It's also important to avoid arguing with the person about what he or she sees, hears, or believes. You know, it's a natural reaction to try to correct the person, but unless the behavior becomes dangerous, you might not need to intervene. Leave them alone. If they are not upset, for example, as I said, Rebecca's mother, she seemed to enjoy talking to this person. It wasn't doing her any harm, so it's best to just let it be. So it's also important to offer reassurance. Reassure the person with kind words and a gentle touch. For example, you might want to say, "Don't worry, I'm here, I'll protect you. I'll take care of you." Or, "I know you're worried. Would you like me to hold your hand and walk with you for a while?" Gentle patting may turn the person's attention towards you and reduce the symptom. You know, it's very interesting how something so small can actually put the person in a different headspace, and it can actually manage that behavior at the time. Also look for reasons or feelings behind the hallucination or delusion and try to find out what it means to the individual. For example, you might want to respond, "It sounds as if you're worried," or "I know it's frightening for you." This way you are acknowledging their feeling and supporting them at the same time. Now, this is one of the best ways to actually distract the person, and we use it quite often. And it actually really works from my own experience and from what caregivers tell me. Suggest that the person come with you for a walk or sit next to you in another room. Frightening hallucinations and delusion often subside in well-lit areas, believe it or not. So put on the lights. You might also try to turn the person's attention to a favorite activity, such as listening to music. Music is amazing in all respects. Drawing, looking at photo albums, reminiscing. One caregiver said that counting coins was one of the ways that her husband absolutely loved to do, because he used to work in a bank. So that's interesting. Helping you with some chores in the house, asking them to come and have a cup of coffee or tea with you of a break. Now, it's really important to respond honestly, but I'm emphasizing that, and I'll tell you why. Keep in mind that the person may sometimes ask you about the hallucination or delusion. For example, if he or she asks, "Do you see him?" you may want to answer with, "I know that you see something, but I don't see it." This way you're not denying what the person sees or hears, but you avoid getting involved in an argument. That this response also helps to normalize the person's experience. Use this tip only if the person asks you, because as I said before, if they're okay and they're enjoying and it's not harmful to them, just leave it alone. Now, it's very important to modify the environment. So what do I mean by that? You know, if the person looks at a kitchen curtain and sees a face, sometimes they see things, as I said, you may be able to remove or change or close the curtain. So turn on more lights, as I said before, to reduce shadows that could look frightening. If the person insists that he or she sees a strange person in the mirror, it's possible that the person doesn't recognize themselves. So you might want to remove that mirror. If the person has delusions about people stealing from him or her, have some duplication of these items on hand so they can provide the person with a replacement, you know, if it becomes lost. I'm going to talk a little bit more about the environment a little bit later on. But now I do want to kind of look at when I said about medications, in the last resort, if all of these things really don't work and you're still waiting to see the doctor, or if you've seen the doctor. So while non-drug interventions are often effective, medication can be helpful in some cases when the person is persistently upset by the symptoms of non-drug approaches that you've already tried. You may also want to ask the doctor to evaluate the person's to determine if the medication needs to be added or adjusted or reduce hallucination or delusion. If the person has a history of serious mental illness, such as schizophrenia, the hallucination, or delusion may be related to that illness. So it's important to let the doctor know. It's important to work closely with the doctor to help determine an appropriate course of action. So I would like to open up for questions or thoughts, or maybe things of how you dealt with certain situations.
Please feel free to unmute yourself or to press *6 on your phone. We'd love to hear from you. Make our podcast more interesting.
And give me a chance to heal my throat that I had just gotten over laryngitis.
So Lucy, just you're probably going to cover this. I'm sorry. Sometimes
No, that's fine. I'll let you.
I think especially people that I've noticed working in nursing homes and adult day healthcare, that a lot of times the medications are predicted to be needed when someone is suffering from really bad anxiety or agitation, because those things, can lead to people seeing or feeling or believing something, because they're just so agitated. What do you think about that?
Absolutely. I mean, I do a whole session, which I'm going to be doing, I think, this month, yes, on safe use of medication. All medications have side effects, each one of them, over-the-counter medications, vitamins, holistic medications, they all have side effects. Unfortunately, and I don't want to get too much into it, as we age, we absorb and we don't eliminate as quick as we did in the past when we were younger. So there's accumulation of that. And take into consideration that most seniors take at least between 5 and 9 pills a day, several times a day. So you could just imagine what goes on in the system. So yes, that's why I said it's important to try these other alternative tips that I'm giving you to try and deal with that rather than with the medications. Unfortunately, caregivers have to be on the lookout. You have to be very, very conscious and advocate on behalf of your loved one, especially if someone is in a nursing home or long-term care. Many times, if people become agitated, the first course is give them some more medication to calm them down. Yeah.
Thank you for that.
Okay.
Anybody else?
Yes, please.
We'd still love to hear from you if you've had a thought while we were blah, blah, blahing. Okay, I think it's back to you, Lucy.
Yeah, next slide, please. Thank you. So here are some tips how to respond and support your loved one when they're experiencing a delusion, hallucination, or paranoid behavior. Now, I went over it a little bit, sort of overall. I just want to get a little bit more into the nitty-gritty part of it. So it is very important to encourage them to talk through their thoughts. Now, obviously, it's for people who are still able to express themselves. If someone is totally not able to express themselves, then I think that the best thing to do is really to try to distract them as best as you can. It's also very important to acknowledge their distress. If we're upset, don't we want to be acknowledged and not sort of poo-pooed? Try gently to offer an alternative, reassure them that their concerns are being taken seriously. And most importantly, don't take it personally. Now, I'm going to talk about each one of these a little bit more. So what do I mean by encourage them to talk through their thoughts? It may reveal what is behind their delusions. For example, if they don't believe their home is their home, it may be due to a recent change in furnishing or unfamiliar people in their home. You might have an electrician, a plumber coming in. Remember, I talked about how important the environment is. Now, listen, maybe you've decided you'd like to rearrange your living room because it's kind of boring, or you'd like to do, maybe you even bought furniture. Keep in mind that even those little things can cause someone to hallucinate or be delusional because they feel that this is not they're living. This is not their home. So the environment plays a big role. And as I said before, lighting is so important. And even a picture on the wall, if you see your loved one looking at a picture and is becoming frightened, you know, something's going on there, you know, or they might see a picture and just love it and stare at it and be very happy. But it gives you a clue of what's going on. And maybe you, if it's frightening them, maybe the picture should be removed. It's also very important to acknowledge their distress and how they must be feeling. You know, dismissing their concerns or trying to distract them without acknowledging their concerns first can cause the situation to escalate and cause them to lose trust in you. For example, if the person thinks that you're stealing, listen to them, acknowledge them, don't yell at them, I'm not doing that. How they must be feeling and support, you know, suggest supporting them to find the missing item, for example. Gently suggest another activity which may distract the person and cause them to forget their delusions. I guess what I'm trying to tell you is they're not going to change. You're going to have to change your communication styles with them. And even though nobody wants to be accused of stealing or feeling, you know, badly about it, you have to remember, and I'm going to emphasize it over and over again, it's the disease that's really accusing you. It's not your loved one. You know, try to gently offer different alternative explanation for what may have happened and present this as another possibility alongside their delusion rather than an opposing view. So really, don't argue. Don't ever argue and don't ever try to convince them otherwise. It's not going to work. It's only going to upset them and will upset you. And as a caregiver, you have enough on your plate. You don't have to deal with these issues as well. Reassure them that their concerns are being taken seriously. If the delusion is ongoing and causing significant problems, try ways to avoid further distress. For example, if they believe that their friend is bringing over poisoned food and this is causing them to stop eating, this is honestly a true one that one of the caregivers told me. The friends and family wanted to assist and be helpful. They used to bring in food, and husband really believed that they were all trying to poison him and he stopped eating. So the thing is, don't accept the food, or if you're going to accept it, don't let him see that it came into the house. But it could be any situation. It doesn't necessarily have to do anything with food, but if they're upset about certain things, that's really, really important to look at that. So can we go to the next slide, please? I'm reinforcing again, and I'll talk a little bit more about, don't take it personally, don't argue, try to find the reasons behind the accusation, reassure without asking too many questions, and it's good to keep spare items, and always, always, always to switch focus, you know. Your loved one may make accusations against people around them, including their family, their friends, and you. The most common accusations are that others are trying to steal from them or harm them. They may also accuse their partner, their spouse, of being unfaithful or of being an imposter. Being falsely accused can obviously be distressing. Please try not to take it personally when the person falsely accuses you. Not easy to do. You need a lot of patience. Remember, again, it's the disease that is accusing you, not your loved one. I'd like to open up now. If any of you have experienced that with your loved one, how have you dealt with it? Love to hear.
Deborah Myers? Did you want to talk to us? Nope.
I see something on the chat. If somebody could read that for me.
I didn't get anything on the chat.
It's from Sandra White. Now it's gone.
Okay. Well, I'd like to ask what you meant by keep spare items.
Oh, good question. Spare items means like keys, spare keys or glasses or hearing aids or wallets or anything that they're kind of used to seeing around them, that possibly, you know, make it lost or things like that.
Okay.
I'm sorry that I didn't get the chat. Could someone put it back on again? Minerva, is there any way that you can help us out with that?
They might have sent it to you directly. I don't see anything on chat.
Oh, okay. Okay. I'm sorry about that. So if you want to do that again, I'd be happy to look at it once more. All right. So when I say don't take it personally, consider that the person may have confused the past and the present. So accusations may be based on things that have happened in the past. All right. So that's something to also think about. They're now, to them, it's still the present. So something happened in the past, and is no longer happening. It's something that they may be thinking about. So again, don't try to argue with or correct the person. What they think has happened feels real to them. Acknowledge their feelings and offer them reassurance. Try to find a reason behind the accusation. For example, a person is accusing someone of stealing something. Is it because the person has forgotten? Maybe they've forgotten where they put it. So, these are the things that you need to think about. However, on this note, I do want to say, if the person is accusing someone else of something, don't automatically assume it is untrue. All right. That's happened many, many times. It is possible, look into whether it could be true or not, especially if there's outside people coming in and out of your home at certain times. Or, for example, unfortunately, sometimes there are people in your family that have taken things in the past. And so we don't want to accuse anyone, but don't automatically feel that your loved one, that thing may have been stolen from your house. I'd love to hear from our audience today before I go any further. So I'd like to open up the chat box again.
The chat box is open. It's been open. Oh, look, from Sandra White. My husband is with hospice and is bedridden, but often insists he has to go to work. I've asked what he likes about his former job. His former is in parentheses. Even that gets him very aggressive.
Wow, that's a different one. You would think that because you are kind of acknowledging about work, so he feels that he's still working. Is that the case? I wish you would come on so I could speak with you. Is it possible for you to get on? Just press star. What is it? Star 6?
Star 6 if you're on the phone, or unmute yourself or go in the chat box and we can have a chat with Lucy by typing chat.
Look, I'll give you another second or two to try and get on.
And we have another person who would like to talk.
Sure. Let me just answer this individual first.
Okay.
Look, what I'm saying is you don't know what's going to cause them to feel anxious or to feel to become very aggressive. So as I said before, you're the one in control, not them. So if a situation or any discussion seems to make them feel angry, change the subject. Little tips that I said, change the subject. You can say at that point, if you're visiting, you know what, let's go out for a little walk, or if the person is in a wheelchair, or I really would love to have a cup of coffee or a cup of tea. Come and join me. So you're distracting.
Ruth Bogart would like to talk.
Sure.
Please go ahead.
Oh, I was just going to say the first thing you might want to try when you see or suspect a hallucination is to check their temperature. Make sure they don't have an elevated temperature, which could mean a bladder infection or something like that going on.
Yes, thank you so much for that. That's exactly a very good way to see if something, because remember in the beginning I said, if somebody is displaying any form of different behavior, call the doctor right away. And yes, by taking the temperature, it's a good way to say to the doctor, and I'm going to include it in my next time I talk about this. Thank you for that. That he is running a temperature and maybe it is something physical. Many, many times hallucinations and delusion have to do with the person's medical problems that you're not even aware of. And they're not aware of for sure. So that's the first rule. Thanks a lot.
Well, the common thing is a UTI.
Yes, absolutely.
And Melissa Summers would like to speak to you.
Sure.
Yes, hi. I'll put on my face so you can see me. I don't know if
It's
can
a
you
nice
see
face.
oh, thank you. Sorry if the background downstairs in the basement. I was working out. That's my stress release.
Good.
Yeah,
Excellent.
so just a little background. You know, I'm taking care of my mom who's 80. My dad passed away, unfortunately, the end of December 2020. He was her main caregiver, but her dementia was, a little, you know, mild. But of course, 6 months later, you know, it had gotten worse. And then just a long story, we relocated to another state. So she's with me. So initially, I mean, I've had a little exposures because I'm in the healthcare field, but you know, it just initially I was like, what's going on? But thank God I've learned to manage and I've used some of these skills. And now I know to manage better. It's just the moods change so often. So you just don't know when it's coming. So I'll give you an example. One day, you know, she goes to the door, the window, and she says, you know, talks to whomever. And she said she was going to the movies. My mom hasn't been to the movies. She was never a movie lover, but she said, so-and-so is coming to pick me up. So I said, okay, Mom, we're great. Well, I hope you have a great time with whomever and let me know what happens in the movie. So I just leave her and give her time and then she'll just come back and, you know, I redirect her to do something. But it's been a process, but it's, yeah. But I thank you for your tips, additional
Wow.
tips. So,
You
yeah.
are amazing. You are amazing. Because that's exactly what this talk is all about. Is that caregivers need to understand that the person is not going to change. And you've learned, and you know what? So your mom felt good. She wasn't upset. She wasn't hurt. You acknowledged her feelings, which is so important for everyone. You didn't argue. You didn't make fun of her. You just let it be. And she felt reassured, and I'm sure she felt loved.
Mhm.
I also have to say, you know, talking about situations like this, when I say caregivers need to be patient, a lot of it has to do with the relationship that you had with that person before. You know, if you've had a loving relationship, it's much easier to not take things personally. And if you haven't had a good relationship with that person, anything that they say will irk you and can trigger something in you. But you're going to have to step back and really recognize maybe they weren't the nicest to you and maybe they harmed you, but you've decided to be a caregiver right now. So that's the point, is that in order for you, mostly for you as a caregiver, to feel that you can manage with this, is to do exactly what you were telling us to do, to just let go with the flow, acknowledge it, forget about the past because you can't do anything about it, stay in the present and deal with the situation at hand.
Yeah. And it's very difficult because we were very close. So to hear her say these things silly. So I just have to remember it's not her, it's the disease. So when I get upset, I talk to the disease. You know, not yeah. Thank
That's another good point that you're making. You know, even if you had a close relationship, for sure, there's a lot of anger when somebody that you love all of a sudden is, and I can so identify with what you're saying. My mom and I were so close, and it took a lot of toll on me to accept, and that's the first step. to accept that that's the reality of what I had to deal with right now.
Sandra White would like to talk to you now.
Yes,
Hi,
please.
finally, sorry it took me so long to get on. I kept pressing *6 and that wasn't working, and then realized I just have to unmute at the bottom. So sorry about all the confusion.
Thank you, Sandra.
So I had, sent that issue about my husband wanting to go to work, or, he thinks we've been invited to a party down south, and he gets very upset that I'm not just getting him up, and it's just, I can't, I have to use a Hoyer to get him up to go to doctor's appointments and things. So it's just not possible to, unfortunately, even get him up and get him into the car and go for a ride. It's not something that is possible right now. Because he is failing, but I'm just always looking for more tips on how to distract him or get him off of that he has to go to work, or we have to go to somebody's wedding reception. And I know not to argue with him and saying that it's not happening, but I sometimes will lie to him and say, oh, they had to cancel it because of COVID, but that sometimes works and sometimes doesn't work.
Well, listen, that's exactly what this is all about. It sometimes works and it sometimes doesn't work. I don't believe in lying, but in certain situations, if you're protecting the person and yourself, I think you're handling it the right way. Tips on distraction. I mean, yes, if somebody says, we have a reception, you could always say, well, it's not today, it's another day. But is there anything at all that he used to like to do? For example, I was talking about music. I mean, I cannot tell you the impact that music has on people with dementia. I do a series on that as well. And as Evelyn knows, I think you do it with me, is that's the last thing that goes. To see what kind of music did he enjoy in the past, and sort of get up and say, I'm just gonna, I don't know how ready it's available for you to have the music on hand, but if we have a computer, it's easy to download any music. Is there anything in particular he used to like in the past?
Yes, and thank goodness through hospice, we have a music therapist that
Right.
comes. Unfortunately, her workload has increased, so she can't come weekly anymore. She can only come every 3 weeks, but that, seems to calm him down for like a day.
Good.
So that's great. Yeah.
Did you ever try to sing with him?
No, he doesn't. He'll say, not that I'm like a terrible singer, but I'm not a great singer. And he'll say, here's $1, stop singing.
Oh, he will.
Oh, yes.
Well, I mean, these are all things. I mean, again, a lot of people, and everyone knows, doing reminiscing, looking at photo albums. I'm not sure if you have family, but if you have family, let's say that you can either call at that time and say, you know what, I just remembered we need to call whoever it is, grandchild, if they can, anything to kind of distract them. You have your hands full. There's no doubt about it. And you're not always going to win. It's not always going to work.
Right.
As long as you realize that, as long as you don't aggravate the situation more by just letting him be. If he wants to be angry, let him be angry, as long as it's not harmful to him or to you at that moment.
Yeah, that's some of the when he gets upset and has to get up and go to work, he'll demand that I put the side rail down for him, and that he's just going to get up and drive by himself, which of course he can't, but he will fall if he's strong enough to be able to get out of bed. So, and he will just get upset if I don't put the bar down. Then he'll like threaten to hit me. Not that he could, but it's upsetting for both of us.
Well, I'm going to talk about it, but I'll mention it right now. I do believe that you have to have a plan in place if things get out of control.
We,
what I mean
we do. I have
Oh.
medication from hospice, and
okay.
it just it makes me feel bad to give it to him because of course it makes him sleepy and
Well, it's a balancing act, right?
yeah.
Do I let him be upset emotionally for no reason, good reason, and it's agitating him? Or do I give him something that relaxes him and makes him maybe a little bit sleepy? That's
Mhm.
what it's about at the end of the day. And what I want to say to you is please don't feel guilty. You're doing the best that you can.
Thank you.
All
Well,
right.
one thing that maybe this might help somebody else too. I learned fairly quickly when he would call for me and call for mom instead of Sandy. I learned very quickly to just ignore that because at first I would say, "No, I'm not your mom. You know who I am, don't you?" "Yeah, I know." But I learned to just not even to go there. I just said, "I'm here. What do you need?"
Great tip.
Sandra,
And
Sandra's,
that helps. That
yeah,
does help a lot. It's at least it's just not getting into, like you say, I didn't take, certainly my own fears of thinking, oh geez, does he not know me anymore? And that's not the case. So just
It's a-
ignore that and just
There's a-
reassure him that I'm here.
there's a
Yeah.
suggestion from someone who's online for you, Sandra.
Yay.
And this person, Jennifer, says, could you get an iPod shuffle for him to listen to music outside of music therapy sessions? iPod shuffles are harder to find now, but are easy to use for people with dementia because they essentially have one button to start and pause.
Okay. Thanks.
Yeah.
Great. Thank you
Thank-
so much.
Thank you,
Yes.
Jennifer. Very nice.
Are there any other questions and wonderful, wonderful suggestions? Thank you so much. If not, we'll move forward.
Okay.
And- okay, the next slide, please.
Your minion's asleep. Oh, not quite.
Thank you, thank you. Look, I'm a big believer in prevention. I believe that prevention is key in everything that we do in our lives, even for ourselves. Eating well, healthy food, exercising, that's part of prevention. So what I want to say that if behaviors happen frequently, there could be a trigger, as I said. That's not obvious. It's important to figure out what could be causing or triggering the behavior. A lot of caregivers are doing this. Keep notes or keep a dementia journal. This may help you discover certain patterns or triggers, such as that certain behaviors happen at certain time or day, before or after meals, related to physical needs, such as using the bathroom, being in pain or being tired, a change in daily routine. All of a sudden, you've invited somebody over and you notice that this is really agitating them. So that is a good way of looking at things like that. It's a little bit more work, but at the end of the day, it does help. So if you see that they are really agitated before, after meals, these are things that you could be aware of and a way to distract. Sandra White to everyone, could you please send us the PowerPoints? Yes, you will be receiving all the PowerPoints, but Evelyn will tell you how to do that.
Well,
Now, the other things, I'm just looking at the time, we're good. Make another prevention is making places for things to become lost easily. For example, as Evelyn asked me, keys or glasses, keep them in the same place, the same, so that the person becomes familiar with it. Or if something, always have 2 pair of glasses. I'm sure most people do. Hearing aids, whatever it is, making sure the person has regular eye tests and hearing checks. That's a big one to avoid any additional problems caused to sensory impairment. If they hear or see something incorrectly, it could lead to a delusion. Could you imagine? All right. So if for any reason, I know a lot of people don't like to wear their hearing aids, But if they, for any reason, hear something that's really not what you're trying to say, or even if they hear something on the television, I also want to say hallucinations sometimes can happen when people are watching TV. All right. They actually feel that the person is talking to them, or they get angry at the person, or they're suspicious that the person is actually in the house. So that's what I mean by keeping a journal and sort of knowing what are the triggers and how can you actually prevent this. Now, very
Lucy,
quickly.
excuse me, while you're on the topic, would you talk about some of the other benefits of journaling for caregivers?
Well, journaling in general gives you a really good, you can journal for yourself, you know, you can journal about your own feelings, about how you're feeling about being a caregiver and being honest about it. And it's okay if you get angry. It's okay if you feel guilty. It's things that you can actually do, and then find ways of dealing with your feelings. Always acknowledge your feelings. This is a theme that runs through all our podcasts, especially with Dr. Elliot Sklar as well, that I do with him, is things like that.
Thank you.
So yes, somebody wanted to say something?
I said thank you.
Oh, okay. What is very important to keep in mind is that you're not alone in this. Many caregivers are going through this difficult behavior, and it's very important to get support to help you out. Caring for someone with dementia, as well as on top of it, having hallucination, delusions, paranoid behavior, is very stressful. But I also think it's important to tell your family and friends that you trust of what's going on. There are many resources in the community to support you, and Evelyn will talk a little bit more about that. Call 211 to find out resources for yourself. However, as I said before, if the behavior is not managed by distraction or by medication or your support, and it escalates and becomes aggressive, both verbally and physically, make sure you have a plan in place to get help. Call a friend or a family member, and worst case scenario, I hate to say it, you might have to call 911. You need to protect yourself as well as your loved one. So if we can go to the last slide, please. And then we also have lots of that one is good. And then the references at the end. So thank you so much for those of you who have shared your experience with dealing with hallucination, delusion, or paranoia. And thank you so much for your tips. So I thought we'd have a lot more time, but we don't. So before we move on and give it over to Evelyn, are there any other points that anybody wants to make, or any questions that you may have at this time?
You can press *6 if you're on the phone, or press unmute on your screen.
Okay, so if we can go to the last slide. And Evelyn, it's your show right now. And all these articles that I'm telling you are very easy to get on your computer, which will go into all the details that I talked about today.
Okay, folks, so you will be able to get the slides and all of this resource information, which is really wonderful. Thank you, Lucy, for putting that together. When you get your post-session questionnaire. And the post-session questionnaire is really important to us. A lot of people choose not to fill it out, as I know. It's like getting your car fixed and saying, how was your experience? But it really helps us improve our programs, which we always want to do. And it really, it comes with those resources. So, you know, when you get that post-session questionnaire, consider the resources a prize for filling out your post-session questionnaire, and that'll help us out. And I would say to you that if you have maybe got the phone number for this call from a friend and you didn't register for it, that you really need to register. And the reason you need to register is because until you do, we can't send you that post-session questionnaire, and we can't send you the resources. And I want to give you the number to register. That is area code 866-390-6491. It's the WellMed Charitable Foundation Customer Service, 866-390-6491. And here's one of the best things about getting registered. We have a calendar that goes out every month with all of the different topics and experts that'll be talking during the month. And it is chock full of stuff for this month. We've already had a couple. This was, the third one of the month. We've also got avoiding Medicare schemes during fall open enrollment coming up on Monday. We have a Spanish session by Dr. Nestor Proderio, and that is on managing the fatigue of caregiving. That's the 13th. On the 14th, Lucy's back with safe medications. Dear Lucy, telling us how to be careful. On Thursday, September 15th, we have Disaster Preparedness 101 for caregivers with Elliot Montgomery Sklar, Dr. Sklar, and Lucy Barylak. And this is because, if you didn't know it, September is National Preparedness Month, which for those of us in fire zones is really probably good information. On Tuesday, September 20th, we're having Alzheimer's and other dementias. So this looks very interesting, how to prevent them, with Paul Bentheim, who's a doctor at the University of Arizona College of Medicine in Phoenix. He's going to talk about what are the risk factors for Alzheimer's disease, how modifying risk factors can prevent millions of cases, and what each of us can do in our daily life to reduce our personal risk by as much as 50%. That's going to be a good one. And then on September 21st, Lucy's going to talk about safe medications. And on September 28th, excuse me, COVID-19, monkeypox, and flu, fall 2022 caregiver update. And that's with Elliot Montgomery Sklar. Dr. Sklar is an expert. He's a doctor in public health. He has taught us so much over the last couple of years since COVID started. We're so lucky to have him as part of our panels. So with that, I want to thank each and every one of you for being with us today. It has been a great session. Thank you so much, Lucy. You always do such a pretty job.
Thank you, everyone. I just want to say that the safe use of medication is a two-part series. There's the first part and the second part. And for those who are going to register, we are going to send you our free guide that was developed by the WellMed Foundation. It's a guide on safe use medication. So thank you for that.
Very cool. Yes.
Thank you so much, everyone.
Yes, thank you for what you do. I also want to thank the WellMed Charitable Foundation for sponsoring all of this incredible information and the podcast. Please feel free to go to www.caregiverteleconnection.org. Check out those podcasts, because we've been, I think, maybe collecting them for 2 or 3 years now. And it's all experts talking about different topics. And I'm sure one may relate to you, or maybe many. So we get on there and take a look at it. And thank you for being with us. We hope to see you many times again in the future. Bye-bye, everybody.
Thank you, Minerva. Thanks, Evelyn. Bye.
Thanks, Minerva.